might be looking at your life and saying, I'm going to be in therapy forever, but it's not true. Hi, I'm Laurel Wiers, trauma therapist, and it's not an uncommon story for many of my clients. But today was just so beautiful. I had a woman reach out to me, and she had multiple traumas in her life. The way that they were manifesting themselves were that she was struggling to go to work. She was really struggling to function at all. She had been diagnosed with both depression and anxiety, and I diagnosed her with PTSD. She'd gone to therapy for quite some time, and while it was helpful and very supportive, it was not addressing her triggers or this anxiety and this depression in a way that was really bringing relief and getting her above where she was at emotionally. We just started our first session listing all of the moments in her life that have been difficult, the ones that stand out, the ones that you may or may not call trauma. She grew up with a mother who was an alcoholic. She then moved on to have a husband who was an addict, who eventually died of an overdose. She then went on to experience cancer, a horrible divorce, and then lost both of her parents. So definitely a lot for one lifetime. When she came in, we rated all of these events in her life. And so I usually ask clients on a scale of 1 to 10, how intense are the memories when you think about them? And so we rated all of them. Now, in and amongst each of these things, we had multiple memory sets. We had the time when her husband passed away. We had moments as a child that she remembered that were super painful. So she just listed the strongest ones within each of the events that we were going to process in our work together. Most of my clients, when they work with me, I usually say, plan to spend 4 months together. That pretty much, I'd say 80% of my clients, that's all we need now. I know that sounds crazy, right? But it's true. Typically what that looks like is 6 to 8 sessions because I meet with my clients twice a month for 90 minutes. We process during those 90 minutes. We integrate a little bit at the beginning of each session, and then we process each session. So her and I had decided this is what we were going to do. Wouldn't you know, she was done in 4. Now, this isn't the first time this has happened either, but I want to describe how she could get through so much trauma in just a handful of sessions. So the way that this operates is that when you start to deal with trauma from the beginning, which is what I do, the other things that live later on in your life sometimes actually get absorbed when we process memories from earlier in your life. And the reason for that is the other events that happen later are often what we call a re-traumatization of the initial event. So let's say that somebody was abandoned in a relationship when they were younger by their mother, by their father. That memory set is going to be really important, right? In it, it holds that sensation of abandonment. But you may get into other relationships, friendships, or romantic relationships later in life, and you may experience abandonment again. So sometimes we have to process all of those relationships, but sometimes we only have to process the first one because the other 2, 3 or 4, or however many you have, they get absorbed or disintegrate, or however you want to use the terminology, when we process the first original abandonment. So when she came in, while we had a huge list of events, the events started to become less and less intense that were later down the line as we processed her earlier traumas. So session 1, we ended up processing her childhood with her alcoholic mother. The beautiful thing about this, which is so serendipitous, is that her mother actually passed away 2 weeks after we did that session. This allowed her to be able to go through the loss of her mother and to do the funeral and all the things that she needed to with way more ease than she would have had she still been stuck in all this other muckiness around her childhood with her mom. The second session, what we focused on was the loss of her father. Now, her father, she had watched him pass away from cancer. My client also had cancer. So she is worried all the time that her cancer is going to come back. And when it comes back, she's going to look like her father did when he passed. Now, if we were to add a layer on top of it, if you can imagine, she also worked in healthcare. So her work was constantly triggering her. She was thinking, oh my gosh, is that going to be me? Am I going to get that disease? Am I going to look like that? It was super heavy and super burdensome. She's a nurse though. This is what she's trained to do. But suddenly, can you imagine going to your job and being triggered all day? So we processed her father's passing and what he went through with his health issues as he was passing. And that brought so much relief. She came in. So this was only session number 2 sessions. And she was like, I can go to work and I am laughing again. And she said, I'm not worrying about all the patients that come in anymore. I'm not carrying it with me anymore. I don't feel near as heavy at work. She suddenly stopped going into this mindset that's going to be me. Isn't that amazing? It's seriously so beautiful when you can heal and neutralize and integrate certain traumatic memories. The triggering just stops because your body says, oh, we're not there anymore, or we've processed, we've made sense of what's happened, so it doesn't have to keep latching on to all these other things that are reminding your body of this thing that you need to deal with still. Work suddenly became way better to the point that she actually started signing up for doubles. Yes, doubles. She wasn't even wanting to work her normal schedule before, and now she's signing up for doubles. Just incredible. So then the third session she came in and we dealt with her marriage. There were a lot of negative things that had happened in her marriage. We had addiction, we had infidelity, all sorts of things like that. We got done with that and we knew that there were other events that we needed to process, like the overdose. And she comes back for the fourth session and this is what she says. I don't know what to talk about today. And I was thinking in my mind, well, we have a whole list of other memories that we had said that still needed to be processed. Very specifically, her medical trauma from her own cancer journey. And she was like, yeah, it just doesn't bother me anymore. She was talking about how she had all these medical appointments that were coming up. And usually she knew how many months away they were, how many weeks away they were, how many hours away, because she was so stressed about anything that had to do with her health. And she was like, I can't even remember when my appointment is. I had to look at my planner to figure it out. And this is what's so cool about this work. When the session's done, the work that your brain is doing and all the integration, it doesn't stop when you walk out the door. Your brain continues to process, it continues to integrate, and it continues to metabolize a lot of the moments. So here's the cool thing. Just by processing what happened with her dad and what happened with her ex-husband, her nervous system was already recalibrating. It was already at a much more neutral baseline. So much so that when we talked about these other memories that we thought we had to do, they were a zero. Nothing. They didn't bother her anymore. That is what is so incredible about this work, is that you might be looking at your life and saying, I've got so many moments, I'm going to be in therapy forever. But it's not true. It's so interesting how our brains work and how those memory networks are, that when we start to pull the theme of one thing in our life, it's like all the other ones that fit with it, they just get absorbed and they go away as well. So what looks like what might be months or many sessions of treatment could be like this woman. 4 sessions and done. So I hope this gives you a little bit of insight on what it's like if you decide to start down the journey of working with memory integration, of working with somebody who does work with EMDR or ART. I do my LINT method, which is all of those, along with internal family systems work and also somatic work, because I really do believe that we need to express and release a lot of the stored emotion that's in our body as well. So I hope this has been encouraging to you and kind of gives you a little snapshot of what it looks like if you decide to work with a practitioner and start working through your traumatic memories, that it doesn't have to be this really long, drawn-out process. Oftentimes, it can be a handful of sessions and your nervous system can completely be reset and recalibrated once it's processed those really troubling and negative moments of your life.